Hey, Dr. Rucker here. I'm going to do a little slide presentation. There was a request to make a talk regarding my background. Sometimes patients and family members don't know who the doctor is, who is being recommended. So I'm going to give you a little overview. I'm just going to go over my CV. That's curriculum vitae for the non-medical people out there. It's basically your resume in a sense. A little bit about my background and how did I get into this field of integrative medicine, and how do we define integrative medicine. So in a nutshell, to me, integrative medicine is integrating everything available and using the doctor's common sense and judgment. I'm not going to try to spend too long on explaining why the conventional medical model is flawed. But part of the problem is doctors are under the undue sole influence of corporate medicine and their goals. The goals of all corporations are to make more profits. They can say what they want. They want human safety, human happiness, anything. But the goal of the corporation is to make more profits. And that is what's driving the narrative. And once again, without getting too high on a soapbox or too political, I'm just going to say anyone who takes an objective approach without corporate bias to the field of medicine, they're going to come to the conclusion that there are a lot of things out there that work that do not come to the attention of your average doctors. If you go through my Substack, and I'm going to point out my Substack, anyone who's watching this video can get a good idea where I'm coming from by going to my Substack. It is Health Radar is the title, at Ozone Doc. I believe if you just look for at Ozone Doc at substack.com, you'll figure this out, where I'm coming from. Let's see if I can find any kind of basic video. So so you click on it and you'll see this is an example of what I'm going to teach next to patients. I wrote on my Substack, I'm going to write a detailed melatonin guide. I will teach patients through published white papers. A white paper means it's not necessarily academic publication, but it was published by some type of medical doctor or sometimes a pharmacist. So this one is, I'm going to teach the patients how to use melatonin. So if you go to my Substack, you will get a strong feel for how do I approach medicine, what do I recommend. It's a constant evolving library of articles, videos, short posts, you name it. So that's the benefit there, and that will answer a lot of questions regarding how do I think and what's the concept of integrative medicine. So my next slide is going to be a basic bio. Let me try to recenter this. Well, I'll recenter it after I review this side. So I went to the University of Virginia for college. I graduated in 1991. Then I went to UVA for medical school in Charlottesville. And then in 1995, when I graduated, I spent 6 years at Cornell, New York Hospital, and Sloan Kettering in Manhattan. It was 2 years of general surgery and trauma surgery and burn surgery, and then 4 years of urology with a big focus on oncology. I don't think I can underestimate or underreport the value of my training. The next picture here is my CV, but I was trained by very intelligent, capable professors. So you can see New York Hospital, this is surgery years, here's a chief residency, oncology, and then my private practice. I was in private practice in Bradenton and Lakewood Ranch for 11 years, and then I made a shift. And yeah, I'm going to pull up my CV to explain some of that. So you see, I was at Blake, and I was employed by Johnson & Johnson to teach other surgeons how to do laparoscopic surgery. And I was well known as an efficient surgeon for bladder cancer, prostate cancer, adrenal cancer, open surgeries, and also pelvic floor. That means I treated a lot of females with prolapse or hernias of the bladder. And it was a wonderful training and wonderful practice experience, because I started realizing as a urologist, you're the master of that whole area. So when I entered integrative medicine, you can see in 2013, I started Rucker Integrative Medicine. And at this point, I've done a lot of different things: ketamine management, cannabis, sports injury, stem cells. Now I focus on medical director services, partnership services, telemedicine partnership services. So if you're watching this video, you're having me supervise your treatment or supervise through partnership something that you're going through, and I wanted to give you background. I had done a lot of presentations in my course of treatment. In my course of practice, research presentations, awards. I published a lot in the literature. I don't want to toot my horn anymore, but that's my background. And see what my last slide was. Well, that was a blank slide. We're not going to use it. So this last slide, just thank you for watching this video. What I will leave you with is that some examples of therapy I will use are things like, I mentioned cannabis. I'll optimize the patients hormonally when they're fighting a cancer, and then I will use repurposed drugs. An example of a repurposed drug would be rapamycin, which was originally invented for immunosuppression in organ transplantation, but it's also a powerful anti-aging product. Another example is ivermectin. It was created for parasitic infections in mammals. It also works for river blindness. It also works for scabies. Go figure. Now, if you take the same reason it works for those things, and it also worked for COVID, and then you give it to patients, for instance, with various cancers, the inflammatory axis properties, which means it decreases inflammation, those are powerful. And then it also, the same way it prevents parasites from replicating, it can prevent cancers from replicating and growing. So these are examples of how I put integrative medicine and holistic principles at work. I'll probably make more detailed presentations on my background and philosophy, but this is just an introduction to me and my way of thinking. Thank you.